Hello everyone, I'm Yoni Angeli P. Camarate, a first-year nursing student from Davao Doctors College. And today, I'm going to perform my return demonstration in obtaining vital signs on a client. Vital signs are measurements that help assess the client's condition. It also serves as an important indicator to the client's health status. But before we proceed, we must first verify the need to perform this assessment. And this could be done by checking the medical records of the patient. So after verifying, we will now proceed with the preparation of our needed equipment. This includes a digital thermometer to measure the client's temperature. We also need a stethoscope to listen to the internal sounds of the human body, a BP apparatus or sphygmomanometer to measure the client's blood pressure. We also need cotton swabs to clean the earpiece, diaphragm, and bell of the stethoscope, and also to the digital thermometer. We also need a sterile gloves that will serve as our personal protective equipment. And lastly, alcohol for hand hygiene and disinfection. Now that we're all set, we can now proceed to the patient's room and start the assessment.
Prior to the assessment, we should close the door and fix the curtains to secure the patient's privacy. We should also provide adequate lighting and adjust the room temperature for the patient's comfort and perform the proper hand hygiene.
Good morning, sir. I'm Yoni Angeli P. Camarata, your student nurse working with you today. But before we start, can you please state your name
My name is John Michael P. Camarote.
and your birthday, please?
November 14, 2007.
Okay, and what would you like me to call you?
John will be fine.
Okay, Jan. So for today, I'm going to get your vital signs and I'm going to touch some specific places of your body. And there's a movement that you should follow or execute. Will that be alright with you?
Yes.
Okay, it would be better if you're relaxed. So please make yourself comfortable. Um, and if in any case there are some questions or concerns, please feel free to tell me and rest assured that all the information will remain confidential. Okay? So now, the first thing that I will check will be the temperature, and it is very important because it reflects the balance between the heat loss and the heat produced of the body. And there are a few sites from which we could obtain its measurement, but today I'm just going to take his temperature through his oral and axillary sites. Okay, so today, John, I'm going to take your body temperature and I'm going to touch certain parts of your body, and there's a movement that you should execute or follow. Is that okay with you?
Yes, it's okay.
Okay, so now, first I should put on my gloves. Okay, go. So now that I already put on my gloves to avoid cross-contamination and to take the body temperature of my patient, I'm going to use a digital thermometer. But first, we're gonna disinfect it. Okay, using this cotton swab. Okay. And I'm going to put it in the posterior sublingual pockets of my patient's mouth. So John, can you please open your mouth? Okay, open. Wide. Can you please open your mouth, please? Okay, you can now close it. Okay. And now we're just going to wait for a minute or up until the thermometer beep, which indicates that it has already obtained the temperature. Okay. So your body temperature is 36.4, which is in the normal range. And now I'm going to disinfect this first and remove my gloves. And perform hand hygiene. And record the document that I've gathered on the patient's TPR sheet. Now, I'll proceed with taking the body temperature of my patient through axillary method. But first, I still need to do the pre-introductory method, which is to provide privacy and comfort to the patient, introduce myself and the procedure that I'll be doing, and then perform hand hygiene. Okay. So, good morning, sir. I'm Yoni Angeli P. Camarata, your student nurse working with you today. Before we start, may I know your name, please?
My name is John Michael P. Camarote.
And your birthday?
November 14, 2007.
And what would you like me to call you?
John will be fine.
Okay, so today, John, I'm going to check your body temperature through your axillary. And to do that, I'm going to pull up the sleeves and I'm going to put the digital thermometer in your armpit. Would that be okay with you?
Yes, it's okay.
Okay, now I'm going to disinfect first the digital thermometer before I'm going to put this on his axillary. And I need also to take a look if there are any scars or lesions, and pat dry if the area is wet or moist. So Jan, can you raise your arms for me? Okay. Okay. Let's try. Okay. Now we'll just go. I'm going to put this thermometer. Okay. We're just going to wait for a minute or up until the thermometer beep, which indicates that it has already obtained the body temperature of the patient. So John, we're going to wait for a minute or up until the thermometer will beep. Is that okay?
Yes, it's okay.
Okay. Okay. So your temperature is 36.1, which is in the normal range. Now I'm going to disinfect this again. And perform hand hygiene and record or document the data that I've gathered on the patient's TPR sheet. Okay. 36.1. The next thing that we're going to check is the patient's pulse rate. Taking the pulse rate help us determine the patient's heart rate as well as evaluate the pulse strength, regularity, and character. Irregularities could suggest a heart disease that needs to be looked into. Now I'm going to take the patient's pulse rate, but to do that, I'm going to palpate the patient's pulse point to measure it. But for now, I'm going to palpate for his radial pulse because it's the most accessible and the simplest site. So before that, before the assessment, I already closed the door and adjust the lighting and provide temperature for my patient's comfort and also perform hand hygiene. So, okay, good morning, sir. I'm Yoni Angeli Camarate, the student nurse who will be attending to you today. Can you please state your name?
My name is John Michael P. Camarote.
And your birthday?
November 14, 2007.
Okay, so for today, sir, I'm going to measure your pulse rate. Is that okay with you?
Yes, it's okay.
Okay, can you please lend me your hand? Okay. So to locate the pulse, I'll use these two fingers of my hand to find the radial pulse rather than my thumb, since it has its own pulse. So I'll trace along the thumb side on his inner wrist here, and lay my fingertips in this area to check for a pulse. Okay. This will be evaluated on a 0 to 3 plus scale, with 0 indicating no pulse, 1 plus indicating a weak pulse, 2 plus indicating normal, and 3 plus indicating bounding. Check the rhythm to see if it is regular or irregular. Okay. Now that I already found his pulse, radial pulse, I'm going to start counting the beats per minute. Okay. Okay. So your pulse rate, sir, is 79 beats per minute. It is in the 2 plus, which is in the normal, and it has a regular rhythm. Now I'm going to record or document the data that I have gathered. Okay, and perform hand hygiene. Now we're going to assess the patient's respiratory rate. So before the assessment, I already closed the door for the patient's privacy, provide adequate lighting, and adjust the temperature for the patient's comfort, and then I will perform the hand hygiene. Okay. So, good morning, sir. I'm Yoni Angeli P. Camarate, the student nurse who will be attending with you today. So, could you please state your name?
My name is John Michael P. Camarote.
Okay, and your birthday?
My birthday is November 14, 2007.
Okay. So, for today, sir, I'm going to measure your respiratory rate. Will that be alright with you?
Yes, it's alright.
Okay. So, first we need to help the patient to be comfortable. Okay, just pull at Easter. Your legs, please. And then in the lower chest or the upper abdomen, place his arm like this. I'm not only calculating the number of breaths he takes when I count her respiration rate, I'm also counting the depth of her breathing, and I am also going to check if the patient's breathing is labored or not. Also take note that one rise and one fall of the patient's chest is equivalent to one respiration rate. So just inhale and exhale. Okay, sir, do you encounter any problem during breathing?
No, I don't.
Okay, so your respiratory rate is 15 beats per minute, which is in normal range. It has a regular rhythm and is unlabored. Okay, I'm going to write the data that I've gathered on the on his TPR sheet. Okay, and then disinfect my hands using an alcohol. So I'm going to check the patient's blood pressure. Blood pressure is the force exerted by circulating blood against the artery walls. It can be obtained with a stethoscope and a sphygmomanometer. So Before the assessment, I already closed the door to protect the patient's privacy and adjust the room temperature and provide adequate lighting to ensure the patient is comfortable. And also, I need to perform the hand hygiene. So, good morning, sir. I'm Yoni Angelica Marata, the student nurse who will be attending to you today. Can you please state your name?
My name is John Michael P. Camarote.
Okay, and your birthday?
My birthday is November 14, 2007.
Okay, so for today, sir, I'm going to check your blood pressure. Would that be okay with you?
Yes.
Okay, so now we need to place the client appropriately unless otherwise instructed. The client should be seated with their feet on the floor. As blood pressure arises when the legs are crossed, so slightly bend the arm with palms facing upward and arms supported at heart level, because if it's lower than heart level, it will give us a higher BP reading, and if it's higher than heart level, it will give us a lower reading. And now expose the upper arm. Okay, I'm gonna roll off the sleeves. So we need to check the cup size and make sure everything is okay. Okay, and we also need to make sure that the patient didn't ingest any caffeine or smoke 30 minutes before measuring. So, sir, did you drink any coffee or any energy drink earlier?
No, I don't.
And do you smoke, sir?
No.
Okay, that's good. So now I'll have to do the preliminary palpatory determination of his systolic pressure to avoid getting a lower systolic reading by auscultatory method if there is an auscultatory gap. So I'll start by wrapping the deflated cuff around the upper arm evenly, and by using my 2 fingers, I'm going to locate the brachial artery and then palpate it. Okay, now that I've located his brachial pulse, I'll begin inflating the cuff until the pulse on his brachial artery is no longer felt. Okay, so I already taken his systolic blood pressure with the reading of 100 millimeters of mercury. So to prevent missing the auscultatory gap, which is the brief disappearance of the cut-off noises while deflating the cuff, I'll need to inflate the cuff at roughly 30 millimeters of mercury, higher than the estimated systolic pressure during the actual taking of his blood pressure. Okay. Now I'm going to utilize my stethoscope for this procedure, but first I'm going to disinfect the stethoscope earpieces, diaphragm, and bell. Now I'm going to put my stethoscope in my ear. Make sure that the stethoscope is free hanging from the ears to the diaphragm. Okay. Now I'm going to put the bell on his brachial pulse. Hold the diaphragm with the thumb and index finger. Now, okay. Now I'm going to inflate the cuff until for 145 millimeters of mercury. 45. Okay. Now the first sound that I've heard would be his systolic pressure, and the diastolic is the period of the silence after the last sound that I've heard. So as the pressure falls, identify the manometer reading. So the cut-off phase 1 is the first tapping sound during the deflation, and the phase 4 is the muffled sound with soft and blowing quality, and the phase 5 is the last sound heard. Okay, now after deflating the cuff rapidly, and we need now to repeat again the steps. So repeat against the steps to confirm the accuracy of our reading. So ma'am, I'm going to repeat the procedure. I mean sir, I'm going to repeat the procedure once again. So just feel at ease. Will that be okay with you?
It's okay.
Okay. Okay. Okay. Okay. Need to repeat. Okay, so sir, your blood pressure is 100 over 70 millimeters of mercury, which is within the normal range. And after deflating and removing the cuff, we need to disinfect with alcohol. Okay, we need to disinfect and record the data that I have gathered on the patient's TPR sheet. Okay. So sir, to sum up everything, your temperature is 36.4 and during the oral method, which is normal, and 36.1 when I obtain it through your auxiliary method, which is also normal. Your pulse rate is 79 beats per minute, and it is in 2+ scale, normal scale, and it has a regular rhythm. And for your respiratory rate, is 15 breaths per minute, which are also in the normal range, and it has a regular rhythm and is unlabored. And lastly, for your blood pressure is 100 over 70 millimeters of mercury, which is in the normal range. And that's all, sir, for this assessment. Okay, thank you for participating. I'm just going to give this to the doctor. Okay.